Good afternoon, everybody, and welcome to the Interoperability in Action webinar series number 4, Blockchain in Healthcare. A couple of quick housekeeping notes. Today, we are going to be audio recording this webinar. For the attendees, your lines will be muted. If you have any questions that you want to convey to our presenters, please use the chat or Q&A feature. I'll be doing some polling today, so please be on the lookout for some polls later on in the presentation. Thank you very much, and we're going to start off today with Steve Posnack. Thank you.
Thank you. Okay.
Steve.
Always good to do a check. Thanks, everyone, for joining. We appreciate you attending and taking some of your day out to watch this series that we call Interoperability in Action webinar series. This one's focused on blockchain and healthcare. I first want to thank the entire contract team that helped facilitate all this, and especially the facilitators, as you can see up there on the agenda, from ONC and our colleagues at the Assistant Secretary for Planning and Evaluation. We've been interested in blockchain for several years now. Our first activities, which you can find on healthit.gov website through our Tech Lab pages, include Ideation Challenge, which many of you, I'm sure, listening in have probably participated in, yielded over 70 white papers around blockchain and healthcare. We have done a co-sponsorship of a workshop with NIST. It happened a year and a half ago, and I'm glad to see that we've got one of our colleagues from there give a presentation today. We also sponsored Codeathon with some of our other colleagues, the Digital Chamber of Commerce and other stakeholders. And we've really been, following along and engaging with many of you and having conversations about the usefulness and application of blockchain in healthcare. So I want to thank everyone for joining again. Very much interested in all the open dialogue that we have. I'm very much encouraged as well that, and I think a treat for you today, that we've got a number of different federal agency speakers be covering interest and intersection in blockchain. And without further ado, I will get out of your way and get on with the show. Thank you very much.
Of the Secretary for Planning and Evaluation. And today we're going to have our next speaker, who's Rashida Dorsey. She's the Division Director, at Data Policy at ASPE, which is the shorthand for the Assistant Secretary for Planning and Evaluation. She'll briefly talk about the work her office does, so I'm going to hand it over to her.
First, let me thank everyone for attending this webinar. Very excited for ASPE to partner with ONC to present opportunity for everyone, including myself, to learn about how HHS may start incorporating blockchain technology across the department. As Director of the Data Policy Division in the Office of the Assistant Secretary for Planning and Evaluation, called ASPE, advises the Secretary on policy development in health, disability, human services, data and science, and provides advice and analyses on economic policy. The Data Division serves HHS policymakers by providing relevant, coordinating, and analysis of a broad range of data and statistical policy matters arising across the department. It works to ensure that the data and information are available to support HHS's policy and programmatic needs. We do this by providing better insights into issues such as data access, data sharing, data linkage, and data quality from both top-down and bottom-up views, and I'll provide expertise in areas such as survey and administrative data, privacy policy, data standards. We also have folks who work in health IT. Directed by the Department of Health and Human Services are essential to support the department carrying out its mission of advancing the health and well-being of all Americans. A departmental report on data strategy noted it would be difficult to conceive of an HHS program, mission, or policy initiative in which data and information do not play a central role. And recently, data, specifically leveraging the power of data, was identified as a strategic shift area under the department's Revision HHS initiative. As the next several hours, there is the potential for blockchain technology to help improve data policy and programmatic needs such as help improve the ease and trust of how the department's data is managed and shared between individuals both in and outside of the department. Thank you again for participating in this webinar. I look forward to learning with all of you from the presenters and rich discussion.
Thank you, Gita. Our speaker's up next. Our speaker is Justin Herman. He's the GSA Emerging Citizen Technology Lead, and he'll talk about the opportunities available for those who want to share, learn, and participate in advancing U.S. government blockchain initiatives. Justin?